It has come to my attention that some of you all are not happy with my reference to home births in my post about the late Tori Bowie. And I just want to kind of throw out a couple of points and thoughts. One is, I don't know that she was attempting a home birth. I actually had no even intention on suggesting that she was attempting a home birth. I said she was at home and she was laboring when she was found, but then I said this also reminds me of what makes me so nervous about home births, because I've seen too much. I've been in practice for 12 years. I've been practicing for 16 years, but I've been, on my own as an attending for 12 years. And I've seen so much. You don't have to have risk factors for something to go left in labor. You don't have to come into the pregnancy with, concern for there to be a new and surprising concern. And so I've kind of taken I want to show you guys some literature references just for the sake of kind of broadening the conversation. And I'm not saying that a person can't have a home birth. I'm not saying that people who have them are not, rock stars for being successful at it. But I am saying that you are taking a chance. If you get in a car and you drive, or you ride in a car without a seatbelt, you're taking a chance. You would hope that the car gets from point A to point B and there'll be no problem. But if there's an accident, you don't have time to put your seatbelt on right then. You're in the accident, and whatever's going down is going to go down. And again, I've seen too much to be comfortable doing something that is so tender and sensitive and requires so much care as a delivery. And let us also remember that we are talking about a state in our society where Black women are dying at 2 or 3 times higher the rate than white women. And so, yes, we can talk about implicit bias. We can talk about provider training. We can talk about, health disparities. But I'm not going to put my most vulnerable in an even more vulnerable space. Like, that's just not how I'm going to live as a provider. And it's not me trying to shame people. It's not me trying to invalidate people's experiences. But it's like, if I'm walking a tightrope, I'm going to have a harness on and I'm going to have it connected to something so that if I fall, something is going to catch me, or someone is going to catch me. And I've caught a lot of people, and not just me. Oh, I'm Dr. McDonald. No, I'm talking about that blood pressure cuff and that IV and sometimes that scalpel. You see what I'm saying? Like, there is a lot more to this than just hoping that it goes well. And I pray that everyone's deliveries go well. But that terrifies me. And knowing that she was at home doesn't mean that she intended to be at home. It means she didn't have anybody watching her. She didn't have anybody monitoring her. Even if she had a midwife. Midwives are wonderful. But a midwife can only save you to the extent that a midwife is able to save you. Just like I, as a provider, can only save a person to the extent that I can save them. I need things around me. I need apparati. I need, I've just stopped a hemorrhage the other day with a device that you will not find at home. Like, you can't have it at home. And this person would have probably bled to, I don't know if to death, God forbid, but she would have bled a lot more than she did if we didn't have what we had, and we had no reason to think that was going to happen before it happened. So let me present the data, but I just want to, dispel any belief that I'm just biased because I'm an OB-GYN. I've seen too much. So this is from ACOG, which is the American College of Obstetricians and Gynecology, which talks about a 2-fold risk of perinatal death, which is infant death, and a 3-fold increased risk of neonatal seizures and serious neurologic dysfunction for those who deliver at home. Now, we're not talking about maternal death. We're talking about infant death or injury. And I think that comes from some of the lack of monitoring. There are obviously more interventions when a person is, or there can be more interventions when a person is delivering in a hospital. But one of the arguments about that is that the interventions are for the purpose of reducing things like this, like infant death or infant injury during delivery. So, it's like that. It's kind of a trade-off. You may have more interventions in the hospital. You may not, by the way, but you may. But that is to reduce these complications for baby. And I also just want to add that, although, it seems like I'm focusing on home birth, but part of it is because I know of a lot of people who've seen these statistics when it comes to maternal mortality and morbidity, which is harm and injury for Black moms as being associated with the healthcare setting. And while interventions do come with some risks, depending on what the intervention is, a lot of the deaths are occurring due to things like preeclampsia, due to things like clots. And so what turns that around is attention to health disparities, reducing racial bias and implicit bias, also self-advocacy and advocacy of family and friends to make sure that you're safe. If you feel like you're being ignored, if you think your concerns are not being listened to, you know, you ask again, you talk again, you check your own blood pressure. You know, there's ways around that. But what I don't think is the answer is removing ourselves from healthcare or stepping back from healthcare, because I think that there's then the opportunity for things to happen that are just not seen and not diagnosed. And that, again, to me is not safer. You know, I worry about my patients of color. I worry about myself. I told you I had preeclampsia. I had preeclampsia with one pregnancy. I had cholestasis of pregnancy with another, you know, and then the middle one was fine, but he was just really big. So, like, you know, there's a risk of hemorrhage there. I otherwise didn't have any complications in that pregnancy, but there's always something that could go wrong. And so my bias is that I've, again, seen too much and can't then take off my safety precautions because a person wants a beautiful experience. I want people to have beautiful experiences. I want them to feel comfortable. I delivered a baby the other day. Practically all the lights were off. The music was low. Our voices were low. Our tone was low. We did the best we could to set the tone that she wanted for her safe delivery. But I'll tell you one thing else that happened with that delivery. You know, she's laboring spontaneously. She is unmedicated. She is not needing Pitocin. All the things are just going, they're doing their thing. And then the baby's heart rate starts dropping. And I watch it for a little bit, and it's dropping some more. And I watch it for a little bit. And I said, you know what? After a little bit of time, I said, you know what? I need you to actually stop pushing for a contraction or two. I know you want to. Your body's telling you to, but I need you to stop because I need baby to actually catch their breath. I need baby to get some blood flow, some perfusion in there. And so she's like, okay. And so she stopped. She breathed through those 2 contractions, and that baby's heart rate came right back up and stayed up for the remainder of, you know, our brief remaining stint of pushing. Had I not known that, that baby's heart rate could have stayed too low for too long. And that's oxygen deprivation. That's concern. Looking at her from the outside, I would have had no idea that that was happening, but I could hear the baby's heart, could see the baby's heart beat. You know, I know her blood pressure. I know what's happening when I'm sitting there with you with your monitors. And so not having those monitors is cool until you need them. Okay, I'm done. I'm gonna get off the soapbox. You know, I like a good soapbox, but you know, I hate that it causes such sadness and hurt for me to talk about these topics for some, because it is a polarizing topic and it is a touchy subject. But I love that it's starting these conversations, because if we don't talk about them, we don't make any progress, right? We don't. If we don't address them, and if we don't speak about them candidly, and if we don't talk about, you know, the physicians who are messing the situation up, or the nurses who could be messing the situation up at times. I'm not saying that all nurses or physicians are messing things up, but we all have to take responsibility for when people are unsafe during delivery. But again, taking off your seatbelt, taking off your harness, taking off your safety net is not the solution to me, in my opinion. Signing off.